It's hard for me to know if you missed one.
I won't miss one.
You want to bet?
Mm-hmm.
Okay. What are we betting? An egg. Free egg. I bet you.
Right.
I know the one you'll miss too, and I'll tell you afterwards.
Okay.
All right. Cool.
Sounds
You
like
can't
a
look at
challenge.
this then.
Okay. This is the Clavotrapezius. This is the Acromiotrapezius. And this is the Spinotrapezius. These are the muscles of the back, superficial muscles. If we move to the arm, we have the same order now. We have the Clavodeltoid, the Acromiodeltoid, right here, Acromiodeltoid, and then Spinodeltoid, right there. And then this is the Levator scapula ventralis. This is the backpack strap that goes across the shoulder. Now if we move onto the arm, the medial side here, we have this superficial thin muscle. This is the Epitrochlearis. If we peel that back out of the way, we can see the long head of the Triceps brachii. That's your long head of the Triceps brachii. Underneath that, we have the medial head of the Triceps brachii. Right there, medial head. And then on the lateral side, we have the lateral head of the Triceps brachii. Right there. Now, if we go back on the medial side, we've got the Biceps brachialis. Right there. That's the Biceps brachii. Biceps brachii. And then this muscle is the Brachioradialis. Okay, back on the lateral side, we've got this muscle right here. This is the Brachialis. The Brachialis is between the Clavodeltoid and the lateral head of the Triceps brachii. You can remember it that way, the Brachialis right there. Okay, moving on to the neck, we have got the Sternomastoid. This is kind of like a necklace going around the neck. Sternomastoid. And then, superficial to the trachea, we've got the Sternohyoid. You've got two of them right here. The Sternohyoid, these are high. The Sternothyroids are on the lateral side of the trachea. Then we've got these muscles on the inferior side of the mandible. These are the digastric muscles here. And then this muscle in between those two is the Mylohyoid. Then we've got this large cheek muscle. This is the Masseter muscle. Moving on to the chest now. We've got this first muscle that goes out across the chest and onto the arm. This is the Pectoantebrachialis. Pectoantebrachialis goes across the chest and onto the arm. Next, we have the pectoralis major, pectoralis minor, and Xiphihumeralis, which is the last one in the series. This large muscle right here is the Latissimus dorsi. And you can also see it right here, it's been cut. The Latissimus dorsi, right there. Okay, now let's look at some deep muscles on the shoulder. If I take and push his elbows together, you can see this long one right here. This is the rhomboideus capitis muscle. These many little filaments here, these are the rhomboideus muscles. On the medial side of the shoulder blade, you have the subscapularis. Right here, this whole muscle is subscapularis. And then on the lateral side of the spine, you've got the splenius muscle. That's your splenius. Now if we go deep on the shoulder blade on the lateral side, and we're going to peel this Acromiotrapezius out of the way, this is the supraspinatus muscle on the shoulder blade. Over here, what I've done is I've cut and peeled away the Latissimus dorsi right there, and you can see the infraspinatus right here on the inferior side of the shoulder blade. And then this muscle down here is the teres major. on the most inferior part of the shoulder blade.
Do that again?
This is the teres major right here.
Okay, thank you.
These muscles right here, these are the serratus ventralis muscles. And then up under the pectoral muscles, you have the scalenes. And the scalenes are running with the axis of the body. So there's one there, there's one there. They're running more with the axis of the body. If we peel this latissimus dorsi back out of the way, you can see some muscles here. These are the muscle between the rib bones. These are the external intercostals. Okay, and then moving on to the abdominal muscles. This is your external abdominal oblique. The muscle fibers are running this way. If we peel this out of the way, it reveals the transverse abdominis. The transverse abdominis, the muscle fibers are running in the transverse plane. If we peel that away, we find the internal abdominal oblique, and the muscle fibers are again running this way. And then superficial to that, toward the medial side of the body, this is the rectus abdominis. And this one is also running with the axis of the body. And then one of our connective tissues is this line, this white line. This is called the linea alba. It's a white line of connective tissue. On the back now, we have got this triangle-looking piece here of white tissue. This is the lumbodorsal fascia. Then moving on to the hind limb, this large superficial muscle on the anterior side of the hind limb, this is the sartorius. And so we're going to flip that back out of the way. Next, we have this white piece of connective tissue right here. This is called the fascia lata. And connected to this white connective tissue is a muscle. This is called the tensor fascia lata. This is the muscle that connects to the fascia lata. And then more towards the medial side, we have got the gluteus medius right here. This is the larger one. And then the gluteus maximus is posterior to that. And then we've got the caudofemoralis, which is just a little filament of a muscle here. And then this large muscle on the lateral side of the hind limb, this is the biceps femoris. Okay, now if we go back and we peel the sartorius and the tensor fascia lata out of the way, we will reveal the quadriceps. This is the hot dog here. The center, the actual hot dog, is the, what's this one, the rectus femoris. And then the lateral side of the hot dog bun, this is the vastus lateralis. The medial side, this is the vastus medialis. Okay? And then over here on the medial side of the leg, we've got this large, flat, superficial muscle. This is the gracilis right here. So we flip that out of the way, and I think I've got it all done here. So we start out with the semitendinosus on the very back of the leg. This is thin like a tendon. Then we move to the semimembranosus, and this is much wider like a membrane. So semitendinosus, semimembranosus. Then our first adductor muscle here, this is the adductor femoris. This is the large abductor. Next we have the adductor longus right there. And then next we have the pectineus, which is a much smaller muscle right there. And then we have the iliopsoas, which on this side it's not really dissected out, but it's right there. And the iliopsoas is running with the axis of the body. I've got it on this side. There's your iliopsoas, running with the axis of the body. Now if we go on to the lower hind limb, you can start right here with this calf muscle, and this tendocalcaneus or the gastrocnemius tendon is a good place to start. The large muscle that's attached there is the gastrocnemius, right here. The small muscle that's attached to the gastrocnemius tendon is the soleus. Then we've got the fibularis, which is right here. The fibularis is running on the lateral side of the leg. Next, we have the extensor digitorum longus. And this one is now running along the lateral side, but it curves in and toward the front to come down on the digits. And then we have the most anterior. This is our tibialis anterior muscle right here. Is that all of them? Yeah, that's all of them.